Good morning, everyone. I'm Lyssette Galvan, Public Policy Director of NAMI Texas, which is the Texas affiliate of the National Alliance on Mental Illness. NAMI Texas has nearly 2,000 members made up primarily of individuals and families whose lives have been affected by mental illness. HHSC's LAR includes several requests that, if funded, would strengthen mental health services for Texans and address gaps identified in the statewide behavioral health strategic plan. There are some, sorry, this is my first testimony. There are also some components not explicitly included in the LAR that deserve careful consideration. First, I'd like to express support for exceptional item 1 relating to Medicaid and CHIP services. These systems provide a critical backbone of mental health support for hundreds of thousands of Texas children and adults every year. Without this foundation, access to care and quality of care would be compromised for many Texans. Exceptional item 1 is essential. We must also make sure that there's adequate funding in place for mental health crisis services. With the rollout of 988, the 3-digit number for mental health crisis calls, a 2 to 3-fold increase in the number of crisis calls coming into the system is expected over the next year. Unfortunately, Strategy D23 proposes steady funding for outpatient community mental health crisis services, despite the anticipated decrease in federal funding in the next biennium. Access to crisis services in community means greater ability to experience recovery, fewer admissions to expensive acute settings, and less lives lost to suicide. We must invest in this area. We must build out a stronger community mental health system with the local mental health authorities at the center of coordinating the provision of targeted case management, psychosocial rehabilitation, and other critical community-based services. While efforts have been successful to address waitlists at LMHAs and provide greater transparency into the system, more resources are needed to build out the capacity of LMHAs to prevent waitlists from happening in the first place and to ensure that clients are receiving the level of care that corresponds to their need. This increased investment is sorely needed. We should also have clear insight into how many people are being underserved at LMHAs and what resources are needed to provide them with the correct level of care. A rider requiring quarterly public reporting on this data comes strongly recommended. Having a strong workforce is critical for all of the mental health programs in the state. We are encouraged by exceptional item 2, which would address critical workforce needs. We have LMHAs in the state with 40% vacancy rates, which has detrimental impact on the access to care. As part of exceptional item 2, Texas should refine its state salary schedule for public sector mental health system employees working at LMHAs and state hospitals. It should be adjustable for cost of living variations and for areas with difficulty sustaining a workforce. Part of addressing the mental health workforce challenges in the state requires paying public sector employees what they're worth to enter and stay in difficult jobs that are essential for access to mental health care. NAMI Texas strongly supports exceptional item 4 relating to expanding state hospital capacity. Despite recent investments in improving access to inpatient care, there is still a severe shortage of both beds and of a continuum of services to effectively transition a person out of the inpatient care system. Far too many people experience delays in access to inpatient care and improper support on the back end of their stay. Thousands of people waiting in jail for access to care is an unacceptable reality in our state. Texas should continue to improve its state hospital system in alignment with HHSC's inpatient care plan. Furthermore, we must make sure that services are in place for people exiting the state hospital system and bolster our community mental health services and ancillary support to keep people from needing the hospital in the first place. To that end, exceptional item 3, improve mental health services, should be built out to include the following. Texas should expand the availability of coordinated specialty care for treatment of first episode psychosis. We deeply appreciate state leadership expanding the availability of coordinated specialty care in response to recent events. However, there is still a severe shortfall of coordinated specialty care in Texas, which results in avoidable hospitalizations, incarcerations, and other adverse outcomes. Let's make it available to every person needing access to this life-changing package of service. Texas should direct fund support directly fund support groups and mental health education classes for individuals and families affected by mental illness. These peer support-based programs are shown to reduce feelings of loneliness, isolation, anxiety, and depression. Further, support groups can provide family members the skills, techniques, and resources to support the recovery of their loved ones, improving their opportunities for success. Texas should invest in housing programs for individuals with serious mental illness. Permanent supportive housing programs are essential for improving community functioning of individuals experiencing housing instability or are unhoused. Without access to housing, individuals are more likely to end up draining resources in the criminal justice system or other state services. It is also critical that housing be made available for individuals exiting the criminal justice system or psychiatric hospitals. We must have a continuum of services available for the most vulnerable, costly patients in the system. The HHSC Housing Choice Plan, released in May 2022, provides a vision for mental health housing support. Finally, Texas should increase its investments in the clubhouse model, which is a highly cost-effective community mental health model that helps individuals explore employment, housing, and education opportunities that match their skills and needs to be successful within the community. Thank you for the opportunity to share these comments with you.
Thank you. Next up, we have Gloria Terry.